The environment is challenging that we work in gastroenterology. You know, we're under constant pressure, both administratively and academically, to do better and better. Basically, the challenge has been in the country certainly more financial than anything else. And again, the bigger challenges are in identifying patients earlier and earlier with these changes in the pancreas, and that's been a kind of almost a pet project of mine, identifying these malignancies as they come about in the earliest possible way. So the biggest challenge, I think, in gastroenterology is identifying the patients at the earliest possible time when they're the most curable. The best part of all is that there are some patients, in fact, that are identifiable very, very early, especially especially when they present as a pancreatic cyst, which is a common finding that we see as more and more patients are getting CAT scans and MRIs. We're certainly seeing larger numbers of patients with cysts. Some cysts are pre-malignant. So we're making quite large strides in some of the molecular assessment of those patients to identify which of the cysts are pre-malignant. In the fall that just passed, in 2015, we established the first needle-based RF ablation program in the tri-state area. And what we're doing is we're identifying some of these pre-malignant cysts in some patients and then cauterizing the cyst such that the patients don't need surgery. So potentially that, again, it may well be a game changer. Starting in November, we did our first patient. So certainly it's a very promising field to identify these smaller lesions, and I think that's the big challenge, identifying these lesions early. The best part of Hackensack is the supportive environment that Hackensack provides to allow these kinds of things to happen. You know, I never feel that I'm kind of out on a limb or on an island. There is a tremendous support network around us to do what we do here, and that's, again, that kind of brings home what I've been saying earlier, which is that, you know, the pancreas patient is best treated in a center like this. It's a multidisciplinary center. You have all of the resources you need at a fingertip away. You know, and that improves patient care overall. The patient only really needs to come to one place. They come to one place, they get all of their care, specifically for these complex disorders of the pancreas and biliary tree, in one place, as opposed to a fragmented care system model that sometimes occurs elsewhere. We work and live in a challenging area. You know, the George Washington Bridge is not too far away. Patients oftentimes will, you know, say, "Oh, why don't I just go to the city and have my care?" The good thing is that, and the important thing that I stress with the patients is that there's nothing that they can get in the city they couldn't get here. And oftentimes, again, what is a typical pancreas patient like? Someone who really doesn't want to or can't feel like traveling too far away. So we are providing within the local neighborhood environment all of the care that a pancreas patient can need and certainly could get anywhere else but very close to home.